On average, a hemodialysis patient could be exposed to 300 to 600 liters of water per week, which puts them at high risk of exposure to waterborne pathogens. Repetitive exposure to chemicals or microbiological agents that are present in hemodialysis fluids can cause serious harm to the patients, like bacterial or fungal infections, chemical intoxication, hepatitis, and gram-negative bloodstream infections. To keep patients free from waterborne illnesses, frequent and proper testing and disinfection of the dialysis machines must be performed. In this video, we'll demonstrate how to properly collect samples for testing the dialysis water treatment system. The tests we'll be demonstrating are chlorine and chloramine, bacteria, microbiological and endotoxin, and an AMI chemical contaminants test. Before conducting the tests, the technician, along with relevant leadership and departments, should come up with a proactive plan in case any of the product water results fall outside the acceptable levels for any of the tests. It's a good idea to reference this table from the CDC and the Association for the Advancement of Medical Instrumentation, AMI, that lists the established chemical and microbiological standards that must be adhered to for the water used to prepare dialysate, substitution fluid, or to reprocess hemodialyzers for renal replacement therapy. More information about this table can be found on the CDC's website. The first test we'll be performing is the chlorine and chloramine test. If the machine is not running already, turn it on at least 15 minutes prior to collecting the samples to avoid gathering stagnant water and a false reading. This is a good time to take a moment to gather the supplies required for testing. Remember, they may be different for different tests. Here are the supplies you will need: gloves, goggles, sample cups, chlorine, chloramine test strips. Because RO systems and testing procedures can vary, it's important to familiarize yourself with your facility's policies and the machine's manufacturer's instructions for use in testing. Perform hand hygiene, don goggles and gloves. This test is to be done at the beginning of every day and every 4 hours throughout the day, or before each patient is treated. Grab the chlorine-chloramine test strips and a sample cup. These samples should be drawn from sample port 1, between carbon tanks number 1 and number 2. To make sure we get an accurate reading, we will not use the first sample. Fill the cup and dump the water into a sink or a drain. Collect water for the second time. Use a dip and read test strip to determine the total chlorine concentration of the water sample. Remember, always follow manufacturer's label instructions for use. Record the sample reading. Follow your facility's policies for logging and verifying samples. Notify the appropriate personnel if results exceed 0.1 parts per million. Also, check your policy procedures for what to do in the event that chlorine is above the permissible levels. Typically, the test must be repeated again. If chlorine levels are still high, collect another sample from the carbon tank number 2 using sample port number 2. If tank number 2 shows allowable chlorine levels, the machine can continue to operate. More frequent testing, at least hourly, is recommended. In the event that tank number 2 also tests high, the dialysis using this machine should be stopped. Now we will test product water for bacteria, microbials, and endotoxins, as well as perform the annual AMI chemical analysis test. These tests will be collected simultaneously. Start again by collecting supplies: gloves, goggles, a sterile sample tube, a sterile sample cup, alcohol wipes, biohazard bag, a small bag of ice, a marker, and a bucket. As always, we begin with hand hygiene and donning goggles and gloves. Bacteria and microbiological and endotoxin testing, otherwise known as total viable microbial count, TVC, and bacterial endotoxin, LAL, are two different tests, but can come from one sample. These tests must be performed weekly on all new systems prior to the first use, until 4 results are obtained within the maximum allowable levels. Afterwards, they are collected on a monthly basis, and more often during outbreaks. Additionally, collect TVC and LAL samples right before a regular disinfection of the water system. Microbial and endotoxin samples should be drawn from the first and last outlets of the distribution loop and the outlets supplying bicarb concentrating mixing tanks. AMI chemical contaminant testing is done when the reverse osmosis machine is installed, when membranes are replaced, and annually. This sample should be drawn from the end of the water treatment cascade and at the point most distal in each water distribution loop. This test should be completed prior to starting patient treatments to avoid system alarms and complications. Take the alcohol wipe and wipe the tip of the nozzle for 5 seconds. Let it air dry, then place a bucket under the nozzle and turn it on, letting the water flow. Before taking the bacteria, microbiological, and endotoxin sample, the water should run for 1 minute. While the water is running, doff your gloves, perform hand hygiene, and don a new pair of gloves. Grab the sterile sample tube and label it with the name of the machine. This tube will be used for bacteria, microbiological, and endotoxin testing. Repeat this process with the sterile sample cup. Take the sterile sample cup and check that the seal on the cap is intact. If it is, the cup is still sterile and is fine to use. In addition to labeling the sample cup with the name of the machine, also label it AMI Chemical Analysis. This sample will grab second because the water needs to have been running for 2 minutes for this test. First, taking the sterile test tube, use the clean catch method to fill the tube. Once the tube is filled, securely place the lid back on and flip it over once to ensure there is no leaking. Next, remove the cap and using the same clean catch method as before, take the sample. Turn off the water. Place both samples into a biohazard bag, seal it, and place it on a bag of ice. These samples should be assayed within 1 to 2 hours of collection, or refrigerated immediately in a temperature-controlled and monitored refrigerator and assayed within 24 hours. Once in the refrigerator, doff gloves and goggles and perform hand hygiene. Follow your institution's and laboratory's protocols for completing forms and sending specimens for testing. In addition to proper testing procedures, it's also important to regularly disinfect the water treatment machines. The water distribution loops, main RO, and portable ROs should be disinfected on a monthly basis. Ensure that carbon filters are changed per manufacturer's recommendation. For the safety of your hemodialysis patients, it's imperative that water samples are collected in both a proper and timely fashion to ensure that the treatment water maintains safe and healthy levels.